and all of our panelists being here tonight to have this important conversation with our community. So we have Luke from Stepping Stones, Danielle from NAMI, Jenny from Family Counseling Services, Jason from Rosecrans, Phyllis from Liam Foundation, Javier from Tommy Corral Memorial Foundation, and Kirsten Ivy from Family Counseling Services also. So how the night is going to go tonight is everybody's going to kind of go down the line. I'm going to give you the mic. And you can just kind of go over why you're here tonight and how this topic touches you and what your resources. And then while the audience is listening, they have the opportunity to write down questions. So on your tables over here, there are note cards, so you guys can write down questions as you hear these people speak. And then I also have a list of questions that we'll ask. And then after we're done with questions, we will be going over a safety plan tonight, talking about that a little bit, and then we'll be able to share our resources with everybody. So we will start down here and we'll go on down.
Hi, how are you doing? I'm leading off, so I guess I'm setting the tone. I kind of missed all the instructions. So I'll do the best I can.
You know what? You need to be a little louder.
Is this better?
There we go.
All right. So my name is Luke Zollberg. I'm with Stepping Stones of Rockford. And Stepping Stones of Rockford is a mental health community agency here in Rockford, obviously. Most of my job is overseeing our outpatient services. So we have a counseling center. We serve age 6 and up. I guess, I mean, obviously I was asked to be a part of this panel, and my good friend Danielle texted me and asked me to be part of it. I don't necessarily mind talking to any of you about my own personal experiences with the issue of suicide and suicide prevention. I'm going to save it for, if you do have some interest in talking to me afterwards. But I just wanted to kind of give you guys a little idea of what we do at the counseling center as far as risk management, suicide prevention. We, with every one of our clients, the very first thing we do is a suicide and homicide, risk assessment. Basically, to determine whether or not, the person coming in the very first day, they're struggling with thoughts of ending their life. And so that's always first and foremost on our minds when we're leaving with somebody, because obviously nothing else is going to benefit the person if they're not even there to make it to the next session. So that's always first and foremost. We've got a lot of people that we see that are going through things and are having suicidal ideations, some with plans, some with needs and intent. And we do our best to try to identify those and put in safety plans and, if need be, getting them sent to the hospital. I don't know, am I missing anything? I might have given away too much.
No, it's perfect.
No? Okay. All right, I'm passing it on.
Thank you.
Can you hear me okay?
Okay.
I'm Danielle Angelari. I'm with NAMI of Northern Illinois. We're the affiliate of the National Alliance on Mental Illness. So we were founded by two mothers, both had adult children living with schizophrenia in Madison, Wisconsin, and they noticed that there were few resources, few treatment options, lack of understanding around more serious mental illness diagnoses, and that's how NAMI was founded nationally. Locally, we were founded here in 1984. It's our 40th birthday this year.
Yay!
So we are very, very based in the peer realm work. So we do a lot of family, peer support and education, community education, and then we do a lot of direct work, one-on-one or one-on family with peer services. And I'm here today. I've been with NAMI for 8 years. My life has been touched by mental illness, by suicide, and I just want to give back and make sure that those numbers decrease.
Thank you.
You can hear me, I take it. Like a little intimidating with a microphone. I feel like I should stop beatboxing sometimes.
Please do.
No, that's horrific. Absolutely wonderful. My name is Genevieve Moltby. I am, or AKA Jenny. I am with Family Counseling Services. I'm one of many therapists there. I have been with them for over 7 years. I hail from schools. I've been in education for over 17 years, and I just recently left the school district of Harlem. I am very passionate about students, and I have been touched greatly by a lot of students that have attempted suicide and have died by suicide. So I'm here to sort of represent and take all of this. So, and I would be happy to share any information further on that, or at least if you have any questions, please.
My name is Jason Relly. I'm with Rosecrans Behavioral Health, and we serve the full age continuum. We have several services in Winnebago County and other surrounding counties. I'm the Director of Crisis Services, so I directly oversee all of the individuals 24/7 who go out and do the mobile crisis response. So they're the individuals really, when someone's struggling, who go out and meet them where they're at. If that's through the CARES line, which is a state line, 988 response, that's a lot of time for counties, as well as the crisis co-response team, which is our clinician paired with law enforcement teams. So they're all doing amazing work all of the time to assist anyone who's struggling with these thoughts or ideations or attempts and making decisions to wrap them around with care to the best of their ability to keep somebody safe and here to a next marker of time. And really that's what why I'm here. I've been with Rosecrans 13 years. I've been teaching on this particular topic in some capacity for the last 7. And it just really hits my heart from a personal and professional standpoint. I've been in crisis work pretty much my whole clinical career and will continue to do so because I think we have to have people feeling as successful as they can be while they're here and get them to that next moment in time where they can also feel that success and get wrapped around with a lot of care. So, thank you.
Hello, can you hear me?
Yep.
Okay. My name is Phyllis Gallisat. I use she, her pronouns. I'm with the Liam Foundation, and I'm here because I have personal and professional reasons. I lost my son Liam to suicide in 2018. Shortly after his 18th birthday, he was a senior in high school, just a few weeks before he would graduate. He struggled for 6 months with severe depression and suicide attempts and ideation, and was in and out of treatment for that. And as a trans person, that was really difficult to navigate. And I saw a lot of things that need to be fixed so that trans people can have better access to mental health care, and so that they can be seen as individuals first, and that their needs can be met in that way. It's really hard if you don't respect someone's name and pronouns to build a rapport and have a therapeutic relationship with someone. So we started the Liam Foundation in 2020. We moved to our center on 5th Avenue last year. And so we're settling into Midtown, and we love the neighborhood, and we're excited to be an LGBT resource for people in the area in honor of my son Liam.
My name is Xavier Whitford, and I'm the founder and executive director of the Tommy Carell Memorial Foundation, which is a local nonprofit that we established for our son Tommy, who we lost to suicide in 2014 as a result of depression. He was 19 years old, and again, the pain of losing him and the knowledge of knowing how undereducated and aware we were of how serious of a problem depression is, and that it's number one leading cause of suicide, kind of catapulted us into taking action and starting a nonprofit to increase education and support in our community, specifically around suicide prevention, but obviously it all stems from mental health and treating that, right? So what we do is do support a variety of support groups around mental health and grief. struggles, supporting individuals. We have a Healthy Mind Kids Club that's for 7 to 12-year-olds that works on building self-esteem and healthy coping mechanisms for the young generation, because we're already starting to see that young kids are being affected by anxiety and they need to learn how to identify and talk about those feelings and have coping strategies to deal with it. We partner with NAMI to do a teen group, Hope, as well as we have a young adult group. And we also, one of the things we started doing about 8 years ago was we identified that there was an issue in our community with people who needed mental health services as therapy and counseling, but didn't have insurance or didn't have a way to pay for it, or they did have Medicare, Medicaid, but there's a 3 to 6 month waiting period. So we do most of our fundraising goes directly to support individuals for counseling and pay for that. So we'll either pay for it for however long they need it. We've got local relationships with about 12 different counseling agencies we can send them to. Otherwise, we will help in that interim of that waiting period. So instead of them waiting 3 to 6 months to get in, we'll get them in with someone right away. And then when their insurance can kick in, they can transfer over to that service. We also do mental health retreats that are focused, it's a weekend away for people to kind of focus and gain some tools and relationships with local people to support them through their journey, as well as just a lot of education. We do mental health first aid training in the community, and we offer that for those that work with adults, those that work with youth, for public safety, fire, EMS, veterans, and veterans families. So we're just trying to get as many people educated in the community as possible.
Thank you.
I've got a couple notes in front of me. It's a little late for me, and I want to make sure that the train of thought stays in the station. My name is Kirsten Ivy. I'm a therapist over at Family Counseling Services. I've been there for just this much over a year. I finished my training, actually, a degree posted on Saturday. So, but thank you. Yes. Thank you. It's all worth it now. But what brings me on the panel tonight is kind of the veteran perspective. And I want to point out that my experience with the military, and it's different than everyone else's. And before you space out, because military life isn't very relevant, I want to remind you that a lot of foundational study in PTSD came from research from veterans, which led to the development of our cognitive behavioral therapy and so on. And there is a lot of overlap between the themes that we see for suicide rates, both in the civilian world and the military. One thing I know, after speaking with my peers, is the kind of danger that comes out of sanctifying these positions, where you're almost not allowed to be fully human to be able to process what you're going through because you have a role that you need to play. And eventually this can lead to feeling unappreciated in your efforts and invalidated in your struggle. In a way, it feels that you can't complain to people in your field because they're doing this is what you signed up for. This is what you asked for. Heavy as the crown, roll on with it. And it adds that layer of confusion when you're trying to speak with somebody unrelated and they don't get why you're putting the effort into it that you are. And this bleed over happens over in the civilian world as well. I could go on for a while, so I think I'll leave it at that and pass it on, and I'll be back with my notes.
Thank you.
Hi, my name is Shannon Kopp. I'm with the Rockford Fire Department. The reason we're sitting here tonight, obviously, is to just help educate and, get our word out. The program that I'm part of is called Mobile Integrated Healthcare. And what that program is, it started about 8 years ago. Our chief kind of saw a need to be more proactive instead of reactive. I mean, right now, when the bell goes off, we head to the call, and that's usually too late. So our goal is to be more proactive and to be there, to provide the education, to walk alongside these people and help them stand up with themselves so that they don't end up being our reactive call. Our program is designed, we work a lot with mental health, with addiction, and I'm partnered with a psychiatric nurse from Swedish American, and we get our referrals, whether they're from company level, the people on the fire trucks, We also get our referrals from other agencies throughout the city. And if people who have worked with us in the past have families and friends who may be able to benefit, they'll give us a call. And what we do is we go out there, we meet the people, we build a rapport with them, we meet them where they're at, like what Rosecrans and the CCRT team does. We're just a little bit different. We don't involve law enforcement. We do the fire department. So we get out there, we work when it comes to helping people find a therapist, helping people get their medications, make sure they understand why they're taking what they're taking, why they're needing the coping skills, try to stop things before it gets too bad. And it's been a very enriching and rewarding job, and a little frustrating just because people are people, but we never give up on anybody. And like I said, we walk alongside them until they're ready to stand up on their own. So we're very proud of our program, and we like to just keep it out there and let people know that we're there for them.
Thank you. All right. Thank you guys. All incredible assets to the community. We're so grateful for you. So what we're going to do now, if anybody has questions that they've written down, Jennifer can collect them. I'm going to go over this list of questions. I'm going to project. I'm going to give this to you guys. And whatever question might speak to you or that is maybe in your area of expertise, you can go ahead and answer it. So I'm just going to sit right here. And if you want to project, you can. Otherwise, you can grab the mic. So what are some of the warning signs that someone may want to end their life? What are some of the warning signs that someone may want to end their life?
I can take it first.
Go ahead. And go. Both. You gotta use both, I think.
Got it. Can do. I would break it down into 5 kind of different areas to look out for. And the first would be the verbal cues, where, there can be as blatant speak as like, oh, I just want to kill myself, or, expressing feeling trapped, hopeless, not really feeling like you have a purpose. Especially in law enforcement, military, a lot of those high pressure jobs, there is a lot of dark humor going on as kind of, part of the culture, part of the coping skills. So sometimes these verbal cues can go completely unnoticed. There's also the behavior changes where somebody may withdraw, they may become more isolated, excessive drug use, and noting the very sudden mood changes where, there might have been a persistent state of anxiety and now there's a calm, or, just kind of an indicator that a decision may have been made. Planning activities can be a little bit less apparent, but they can include researching methods on ending life, starting to give final goodbyes, giving things away. And the last factor that I would mention would be the history of mental illness and of chronic illness. Those chronic pain conditions and untreated mental illnesses as well can lead to the trapped and hopelessness feeling and the isolation that really sets up one of the largest risk factors.
Thank you. What are ways in which to respond and support someone who may be struggling with suicidal ideation?
Okay, I guess I'll answer that. I would say that one thing would be to be present and to allow them the opportunity to process and talk about it. But also, talking with them as to what they're feeling and thinking and help lead them to some sort of help and support. Because a lot of times when people are in that ideation, they can't think of like, who are my support people? Who are people that are my safe people? Who is it in the community that helps with this? Because they're struggling mentally, it's hard to just think of those simple things like, who are my safe people? Who is somebody I can call and go to? So a lot of times, just sitting with them,
I this week went, a girl that I know well was struggling, and she called me to come over, and I went and just sat with her. I sat with her for 3 hours and let her talk through what she was feeling, talk through what was going on, and helped her identify, what could you do that can help you feel better, and she's like, oh, well, it always feels better when I take a bath with my salts, and I'm like, okay, well, that's what you're going to do today. You're going to take, and just talking through those different things to help her have a plan of keeping herself in a safe space, and what that's going to look like for her. And I ended up staying with her until her husband got home from work, because I didn't feel confident leaving and not having someone else there with the space that she was in. So the most important thing is to just be present with that person and allow them that place to speak and talk through it. But, and if it's ideation, that's one thing. But if they start to formulate a plan and talk through that, then that's a whole nother level and another step. And that's when you need to get some of these people, contacted in the room to get out there and, get them where they need to be, and connected with that professional help.
Thank you. What more can we do collaboratively to reduce suicide deaths and increase prevention efforts? Yes.
It's a village. We're working together. The more people you have in the village, the better off you're going to be. Sorry. Better? Yeah. Now I'm intimidated. I was going to say, you need a village. The more people in it, the better off you're going to be. And so we need to stay connected.
Just to piggyback on what she said, yeah, I think it's just paying attention. I think nowadays we get buried in our phones and our TVs and our computers, and thank you. We get buried in our stuff, right? We're all escaping all the time. People who are depressed and thinking about suicide are escaping all the time too. And it's wonderful when we do have somebody that seeks out help, but unfortunately, I think the majority of people struggling with severe depression and thoughts of ending their life aren't going to tell somebody. And so that's why I kind of say pay attention. I think as long as we are going to be on our phones and we are going to be in social media and all that stuff, which is never going to be over, right? That's the new reality. I think pay attention, because there's a lot of times where people will post something, right? And maybe if you know them well enough, you know that sounds a little funny, right? Or maybe they all of a sudden ghost social media. Maybe they close their account, or you haven't heard from them for days. Pay attention to stuff like that. Reach out to people if you haven't heard from them in a while. Check on them. And like she said, it takes a village.
And just one final thought on that. And then
We have a couple more. Yep.
Just don't be afraid to ask the question. Some people won't, or outright just tell you what's going on in their mind, but don't be afraid to ask flat out, like, are you feeling suicidal? The more direct you can be, the better.
I will think of a new thought. Great. I get one thought. So I think another thing we have to do is be willing to have the conversation to reduce stigma around it, because talks like this do that, and using the right language around the topic does that as well. I know there's a lot of language we're taught in society, like commit suicide and complete or failed attempt. We want to move that language along so it's something we want to bring to the table, because not many people want to talk about something with those negative connotations or words around it. We want to be able to just say died by suicide or lost life, and have reverence towards what's going on for someone and the struggle they're experiencing or the life that was lost. And if we're willing to talk about it in that way openly, ask the direct questions, then I think we're going in the right direction as a society to be able to help reduce some of those numbers.
Kristen, do you have a thought?
If I talk really fast, does it count as one?
Yes, go.
So I would say we really need to stop polarizing emotional wellness. there's this kind of attitude of go through what I did, especially more senior levels where you kind of expect the juniors to go through what you did because that's how it was. And that kind of mocking for things being better. We hope for the younger generation to have things better. And then, there's mocking for needing to take time for mental health. I think it's very ingrained in a lot of us in military and outside, that kind of soldier through, push on, be strong, get through it. And having to alienate yourself from your emotions and try to feel right away better, it alienates the whole person from the human experience. So,
I'll just add, because she made me think of this as you said that. I think there's so much truth to that because oftentimes when, I hear so many parents say to me, because I work a lot with youth, well, I just don't understand it. I don't understand why they can't get over this. Like, they have this great life. I don't know. They have no reason to feel this way. And it really does it doesn't validate that person's feelings because how they're feeling is really how they're feeling. And oftentimes we dismiss these feelings, especially of young adults, a lot of the times, like, oh, they'll just get over it. And I'll be honest with our story with our son. We knew our son was struggling, but, I struggled and I thought, oh, well, he's just going through it and he'll get through it and be fine, right? Because I went through it and I got through it and I was fine. That's not what it always is. And so the reality is it can be so much more than that. And that's where asking those questions and being direct and noticing that things are different. And, one of the big signs with our son was he started to withdraw from like things he enjoyed, like playing soccer. He just didn't want to play soccer anymore. He didn't want to hang out with family anymore, things like that. And we didn't know that that was a serious sign of suicide and, a threat of suicide. We thought, oh, well, he's just a kid and he's going through it and, he'll get through it. So we really do need to start to validate people's feelings for what they are, whether we understand them or not, whether we've been there or not, whether we agree with it or not, because that person is feeling what they're feeling and they need to be heard and validated.
How can schools and local agencies best partner together to help our students?
I was going to say, come on, schoolgirl, you got this.
Okay, so because I'm no longer in the school district, I feel like I can at least say something. Well, first of all, I think they need to partner. Do you see any schools here? No. So that's my big beef. And I think that we need more representation from administration to talk about suicide and to talk about those awkward topics and to be educated in it, because I don't think that they are. That's all I got.
So as one of the agencies, there are things being done that can go further. I think some schools have started doing screens on individuals to see if they're at risk, and then do have partnerships they call local crisis teams to come out and not to hospitalize everyone, but just to talk to someone and see what's going on and try to get care in their hands right away and get the direct resources right there in their hands. So I think that's one way schools, by just accessing us, letting some of our organizations know when they're going to do some of those things, to have some calming, caring people present to be able to manage the strong emotions that even if you're asked questions or screened or a friend is experiencing something, that might have a ripple effect on what your emotional experience is. So I think that's one way we can continue to partner together, is knowing when the schools are willing to ask the questions, have the trainings, being present through that process, having some warm handoffs to those agencies and services that are directly available in your fingertips, because that's what's going to help, is when someone has that willingness and readiness, being there in the moment. So that is one thing I think is really important.
I will just add, the one thing I've noticed is that we need to be more proactive when it comes to talking about mental health and of youth and the schools. I see a lot of schools being reactive. You know, it's like, oh, something happens, we're going to call people in and we're going to talk about it. And the youth will say, oh yeah, it's great that they brought somebody in and talked about it, but then like 2 weeks later, it's all forgotten again and nobody's talking about it, but we're still struggling. We're still having difficulty with this. So I think just if we can get the schools to become more proactive, and I don't know the answer to do that because we've been trying. I know a lot of us at this table have been trying, but it just seems like they've just got this reactive approach instead of being proactive. Some schools are, you know, and doing it regularly and talking about it and bringing people in, but many are not. And that's a problem because, you know, statistically, the more we talk about it and bring it up and the more that we allow kids to be comfortable talking about it and going, you know, having opportunities to process and have even people there to talk through it about it, the better off they're going to be in the long run. When they're holding it in and not talking about it is what gets them to the point of a crisis a lot of the times.
So I think I would also add to that. Well, there, you know, it's kind of a two points. But the first, I would say, you know, kind of echo the sentiment where there needs to be more efficient training about how to respond, but also there needs to be more staffing that is available to be able to handle this. A lot of the teachers are seeing like 40 kids per classroom every hour. And as much as we want them to be able to be there for the kids, and as much as most of the teachers who go into the profession want to, they simply don't have the availability. So it's, I think being able to approach it where there could be enough staffing and enough funding to where the training happens, we could have a standardized approach to how we go about implementing IEPs and other modifications for schools, and making sure that the resources that the school does have is adequate to meet the needs of the students. Where if there is a calm down room, it is properly staffed or decorated, however you want to say, to be able to meet the needs of it and not putting that financial burden on the teachers. So.
Thank you. Guns are the #1 way folks die by suicide. How can we prevent this?
I guess, well, I would say if a family has a gun or guns, but they're not accessible, that's the most important thing, I think, is that it'd be great if we were able to get everybody to not have them, right? I don't know if that is ever a possibility. But I do know that the access that somebody has to lethal means, and like she said, you know, firearms is the most lethal of means. I think making sure that there's no access, whether it's using safes, whether it's using gun locks, whether it's, but thinking that your kid's never going to find your gun hidden under your, you know, sweatshirt in your closet is not a good plan. And unfortunately, that's sometimes the case, is that, you know, our children and our loved ones, they probably know where we have our guns. So it's always important to know that they're not accessible to somebody contemplating suicide.
That's a huge point about means restriction. I think that's hugely important. The data shows that if we restrict any lethal means, including firearms, that 9 out of 10 times people go on to survive and not die by suicide. So just by taking action to restrict means, to be able to provide those safes, gun locks, separate ammunition and firearm into 2 different spaces, put them somewhere else, other lethal means as well, that means our rates of suicide decrease. Deaths by suicide decrease by being able to provide that means restriction in the moment if we know that's available to someone with that plan, intent, or ideation.
I can handle that one.
Me too.
This might take a while to explain. But ban them.
What are some suggestions you have for talking about suicide and mental health with people who still attach a stigma to these?
I'll take the stigma question. We deal with stigma a lot in serving people with the LGBT community. So I think there's a lot of misinformation. There's a lot of people who are uneducated. And there's some people who are just unwilling to learn and read and, change their mind. But there's definitely people who, if given the information and given the opportunity to listen and be taught, can definitely learn these new things. And I think that's how we remove the stigma, is educating and getting it out there. I know in doing the work that I've been doing, Liam came out in 2015. That's been almost 10 years now, and we definitely have more parents that are, wanting to be supported and wanting to learn, are involved with their LGBT children who are coming out than there were back when Liam had first come out. So I know that there's parents that are learning, education's getting out, they're taking advantage of the programs and the literature and stuff that's out there, and they're learning that there's a better way than, cutting off their kids and traumatizing them and putting them through the pain of, being disconnected from their families. And so hopefully through education and just teaching people and calling out things, in conversations when you hear misinformation or someone, says things like commit suicide, and you have the opportunity to correct them and tell them why, that's a valuable opportunity. And those ways can just reduce the stigma and get somebody to think differently that may not even understand, what they're saying when they say a statement like that until you explain it to them. Now they have new information and they can go forward with that with a new outlook and hopefully learn, that this touches every single person. If you're human, you probably know of someone who's died by suicide. And it's been going on forever. It's always going to happen. So if we can learn the most about it and we can educate ourselves and educate others on the topic, then we can just, be better all around.
This one goes This one goes along with stigma too. So men are told not to talk about feelings, that it makes us weak. How do you try to break society of that, or are there any specific resources for men in the area that we know about?
We started a men's group because we noticed that that's a need in our community, that there's not a lot of men-focused mental health things in our community. And what we've learned through our groups, and that group specifically, is men aren't going to sit around a table and talk like women do. But if you get men together and you give them something to do, like shoot some hoops, do some fishing, eat some food, that they naturally will talk about things that they're struggling with other men and support one another. So it took us kind of talking to some different people of like, okay, it's not going to work putting you around a table and telling you to talk to each other. So what can we do to get you to talk to each other? Because they're struggling just like everybody else struggles, but they do, my husband and I have this talk all the time about not only is he a man who has lost a child to suicide and has his own journey, but he's also a chaplain who's supporting the worst situations out there and going and telling other parents that their child has passed away, or supporting first responders that have had things happen. So his mental health has to be taken care of. And so being able to find ways where, I guess my point to this is there are things out there, but there's not many for men. And it's trying to find ways that will get men to just get together. The more we can get men together, the more that they're going to be able to bond and talk about the things that they're dealing with and support one another. So creating opportunities just to hang out can ultimately help support a male through, a mental health thing that they're going through, is what we found.
Yeah, the general trend would be connectivity. For a lot of these groups that we're talking about are individuals who are struggling with suicidality, and then as well, it's just how do we continue to get people connected to other people? How do we continue to wrap them around with those healthy connections where they could be doing something, they could feel in some way fulfilled, hopeful for something, an activity, and like was said, then those individuals will probably talk about things and they'll feel that they have a social connection. And purpose starts to increase a little bit, right? And that's across a lot of groups, not just men specifically, but those individuals who might struggle or be told their entire life or profession, you really shouldn't talk about your feelings. You have to be strong for others. If you just get them involved in something that they enjoy with other people that enjoy it, a lot of times they're going to recharge some batteries. They're going to be willing to access other resources that someone they really trust and care about gives them as well. Maybe it just comes up in casual conversation. They're like, okay, I'll give that a try, or I'll check it out, or I'll keep coming here every week, and it's still somewhere that they're going, something that they've made a commitment to, that they're going to keep going to. And it's really important when we have that in-group feeling, right? When we feel that there's a sense of belonging for us.
Scenes involving gun threats or violence are chaotic and emotions run high. Suicide may result when confronting a person in crisis. How do EMT teams deal with this type of situation to de-escalate in order to prevent loss?
Well, that's a good question. So basically, when we arrive on scene, we're always looking for ways to, it's about connecting with that person. And we do have, like with any agency, there's always somebody that's really good at being able to talk to other people. And we always try to find that person that has that calming presence. And we put them with that, individual, and we work with making sure that they're receiving, they're being listened to. And sometimes it's just having that person there and being listened to. It is chaotic, but we try to separate the chaos from that individual. We utilize the police department in that when it comes to putting people kind of to the side. And we try to just do more one-on-one with the person that's involved. But yeah, it can be kind of crazy.
Yeah.
And also, we've got some great agencies that we're working. We've got CCRT, who involve their Rosecrans clinicians with police. We can get them involved. We also have our team that goes out, and we just want to be more one-on-one with that person and talk to them and listen to what they're saying and try to let them know that they're being heard. So,
does anyone have experience with the Illinois law temporarily removing a gun in possession of an unstable or at-risk person? Thank you, guys. So that is actually it for our list of questions. Do you guys have anything else? Oh, we have some more. Just kidding. Okay. How do you get a person to seek counseling? Mourning daughter's death 3 years, alcohol use involved. Also, the children have lost a mother.
I think speaking, not for everyone, but there can be, sorry, I lost the train of there can be this kind of sense of things having to be bad enough to go to counseling in order to be able to get services. And there's also the fear of if I go and seek counseling, they might involuntarily hospitalize me. So it's a tricky situation to navigate. And there's no, magical words. I wish there were. It would be so much easier. But sometimes leading by example, being in counseling and saying, or, mentioning role models they might have that are in counseling, and get to know what it is. If there is that rejection and push towards it, don't be afraid to ask the difficult questions, though. Asking, are you considering ending your life? There's enough studies and research to say that this isn't going to put the idea in somebody's head. We can't read people's minds and assume. And sometimes asking gives the permission to say, I really am at my wit's end and I need something.
So when trying to get someone to access care as well as a licensed clinician, a lot of people still think about therapy in traditional models and modes where they're sitting on a couch or they're sitting across from someone's desk and talking one-on-one and having to do that for 50 minutes. If someone's struggling to get to that point of access or that open door to care, there are so many other things that you can wrap someone around with as untraditional or not thought about models of care. There is, equine therapies if they like horses, or even, funding available for some of those things. There is going and volunteering with certain pets. There's things you can make therapeutic to have building blocks towards getting to that more traditional therapy. There's community-based care. There's in-home service. Yeah, it might not be a lot, but if you search out someone's wants, interests, there's some ways to make the entire week in some capacity therapeutic. I've talked to many families who maybe can't get the child to my office sometimes, but just having a family dinner a couple times a week when they were able allowed there to be some more positivity around talking and more openness. So that opened the door slightly to maybe have some willingness towards traditional models of therapy. So we have to think about there's a lot that you can do to wrap someone around with some care if they're not quite at the readiness to walk into an office, because that's really intimidating sometimes.
Thank you. This one said, did anyone see the recent suicide rescue attempt by John Bon Jovi? Anyone can be a hero.
Yes.
Yeah.
This question says, can you speak to suicide in older adults?
What I have learned about older adults is they have more experience in life, and so they are less likely to it's less obvious. So some of the signs that I've noticed with older adults, and by older, I'm sort of targeting 60 and above. One of the big signs is more talk about death. And then an increase in substance abuse is a huge one. And then the other one, more recently, I've experienced this with my own parent, and that is asking for, giving their possessions away is a big one, huge one. And then isolation. They don't want to do any of the stuff that they love. It's very similar to other signs, but because they're older, they've learned how to hide them. And they usually do. I'll give you the statistics. So 1 in 200 adolescents who have tried to commit suicide will successfully, so I use that word, will achieve suicide. In adults over the age of 65, it's 1 in 4. Wow.
Thank you.
I'm just going to project. So it all goes back to that stigma. We talked about it earlier, where older people are always taught that they have to just kind of suck it up and not show any emotions, not show any, that they're struggling at all. So it all goes back to that. And I think that if you have somebody that's older, and you're starting to notice some differences in what they're dealing with, with anything, I think the common theme that we're hearing here is that we just want people to listen. We want people to hear what we're saying and hear what our struggles are, and it doesn't mean they have to solve the problem. That's one thing that I've learned as a mom, is that sometimes, stop trying to fix the problem. Just be there and be present. I think that's been said multiple times during the course of this panel discussion. And I think that happens with your parents as well as they age, and they're from whole different generation. They're from a whole different, we don't talk about our feelings, we hide everything. But if you start noticing those changes, just listen to them and not, get too wrapped up in what you're doing.
Yeah, and I'll just add, because I've seen this a couple times too, and most recently, is that oftentimes when older people are struggling, the first thing is to talk about the physical symptoms, and oftentimes the physical symptoms are a result of the mental health things going on. And so oftentimes I've seen where it's overlooked that this older individual is struggling with a mental health thing because they're only focused on the physical health things. So it's good to just know that if you're noticing things, that to encourage that person to also talk about maybe the mental health things that they're struggling with and going on with the doctor, and not just the physical things, especially in that older generation.
Kind of to piggyback off of that a little bit, especially with the older generation, there is a lot more of a need to kind of reject the notion of having those negative and difficult emotions. So feeling like there's something wrong for having, for being weak. I had something else I was going to say, and now it's gone. But if it comes back, I'll let you know.
So this says, you spoke about the need for partnership to improve mental health options. How do the reluctant partners get brought to the table and become involved? So I know we kind of brainstormed this a little bit, but we go to them.
Yeah.
Over and over and over.
That's what we have to do. I think for a long time we've anticipated people are going to come to us about these topics and things. We put on a lot of different panels and trainings, and where we thought people would be, even resource fairs and things. I think we just got to go there. Where are they going to be? And let's be there and have the conversation. Yes. I think we got to definitely stop waiting for them just to unfortunately come here. We have hope for that. They will, but we can go knock on the door and ask for meetings too.
Yep. Thank you. Okay, thank you guys so much. Does anybody have any additional thoughts to share before we move on and go over the safety plan? Okay, thank you so much. You guys can go back to your seats if you like. And then Allison Smith is going to come up here, and she's going to go over the safety plan with you guys. You can look at it, and we'll talk about the importance of that. Thank you. So everybody, we have copies of safety plans up here. So if you didn't get one, please let me know and we'll bring them over to you. But we have individual copies. Yes. One moment. Yep.
Okay, can everybody hear me? I am Not,
No.
no?
No,
If I sit behind it, is that where?
it's this. That's the only one.
Okay. Can you hear me now?
Yep.
I'm hard of hearing, so I hate this, so you're welcome. My name is Allison, and I have 10 years experience as a therapist in the Rockford area. I'm here to go over what a safety plan looks like with you guys. So hopefully everybody has a copy because I think it's a really good opportunity for everybody to fill it out for yourselves. As Xavier was saying, it's good to be proactive rather than reactive, especially when it comes to safety planning. Sometimes when people are in crisis mode, they can't always recall this stuff. So if you're trying to fill out a safety plan with somebody that's actively in a crisis, you might not get very far. So if we can, go through the steps of this and fill it out for ourselves, they're good to have on you for anybody that's struggling with any type of mental health or substance abuse struggles. Okay. So the first one is write 3 warning signs that a crisis may be developing. This can be individual to you or some of the warning signs that we will talk about tonight. When I work primarily with teenagers and young adults, but also older adults as well, during my initial session with them, we oftentimes create a safety plan before they even leave my office after the first session. And it's good to just keep in your wallet, keep on your fridge at home, keep next to your bed, to always have and grab.
Do you want us to write?
If you want to create your own, I think that's a great idea. I think everybody should create their own safety plan. All right, so number 2 is write 3 internal coping strategies that can take your mind off your problems.
Can you give some examples of what that would be for somebody?
Yeah, so a lot of times when I was working with teenagers, we would use number 2 specifically for what happens if I'm sitting in a classroom and I start to feel like I'm spiraling out of control, but I don't necessarily want to raise my hand and ask for help. What can I do internally while I'm sitting in class to cope with the emotions that I'm dealing with? So one thing that we did was like the 5, 4, 3, 2, 1 skill or the 5 senses skill, right? And so it's what are 5 things that I can see right now? What are 4 things that I can smell right now? What are 3 things that I can hear, 2 things that I can touch, and 1 thing that I can taste? And what that does is it kind of takes you out of that crisis mode and brings you back into reality and grounds you back into the moment that you're in. Anybody has any examples, they can share them as well.
You can watch a movie or a TV show, play some music, or talking the problem out with somebody.
Music is a good one. Chewing gum is a really good one. Mints, candy, anything like that. Number 3 is who or what are 3 people or places that provide distractions? This is sometimes different than the people that you would go to ask for help, which is what number 4 is. Like for example, I would put my dog in number 3, but she's not necessarily somebody that I would go to for help, right? But she's gonna provide a great distraction. Places also, schools that have calming rooms, being able to step away from a situation and just take a break. Then number 4 is who can I ask for help? That one's going to be specific, so specific names of people or agencies that you can go to ask for help. And then number 5 is professionals or agencies you can contact during a crisis. So sometimes number 4 and number 5 overlap. We don't have a list of that tonight, but it is something that we can get to provide everybody with, as well as information on the crisis text line and suicide hotline as well. And then number 6 is write out a plan to make your environment safer. This looks different for a lot of people, but access to guns and more legal means can go in that section. Anybody have any questions about safety planning?
I have a question. I do have a comment. So, to everyone in here who is moved by this topic, being a volunteer on one of these crisis lines is absolutely an option. Most of the organizations will offer pre-training to be able to get you up to speed. So you don't have to go to college for it and all that stuff. You can make a difference just being there and hearing. So something to keep in mind.
You're welcome. Thank you. Thank you guys so much. Yes. So one other thing, 2 other things actually. If anybody would like or needs, we will have a couple of therapists available to talk afterwards. So if you are in need of that, please just let me know. And then we are going to hear about the absence.
Yeah, I just wanted to share that. This is a great audience.
So my name is Jen Blaisdell, I'm the Vice President of the League of Women Boards of Greater Rockford. And so I just wanted to, this is a great audience, and just to let people know, so way back in February of 2020, with 62% of the vote, Winnebago County voted to approve a half-cent sales tax to fund mental health services in Winnebago County. Just is awesome, but here's the next part. So it's gonna sunset in 2026, but now prior to the sunset, in August, the Winnebago County Board voted 15-2 to put it on the referendum for this November. So you need to get out to vote and support that if you so choose. So it's gonna be on the ballot in November, otherwise it will sunset. If it doesn't pass, it will sunset in 2026. But to help inform the community, on October 17th at Pilgrim Baptist Church, the first part from 6 to 7, we'll have a panel discussion where you can find out how that money has been spent, like any questions that you may have. So we'll have a panel discussion at Pilgrim Baptist Church from 6 to 7, and then we usually do a meet and greet. So candidates can then share information about themselves. So again, that's October 17th at Pilgrim Baptist Church. If you have any questions about information, anyway, get out and vote. It's going to be back on the ballot. So,
thank you.